Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for having us today.
Well, thank you very much for having me on the program.
Okay, Minister, let's start with the vaccination campaign. Can you provide us with an update as to how far we've gotten along with the first phase?
Well, I think we're doing fairly well. As of yesterday, we would have gotten close to 20,000 persons who would have been immunized, and I think that's a good number. So as we roll out this week, our plans are that we would increase the amount of sites that we have. So apart from those fixed sites that we had set up, we have been able to work with our healthcare workers at the health center, and you would see us now shifting to a lot of the health centers across the country, because these nurses, they know how to give vaccines. We have given them the additional information pertaining to the 2 vaccines that we are currently using, and so we'll be sending out doses to these health centers so that they can now do the vaccination at health centers. So that's in the process of being rolled out. And by doing that, we anticipate that we'll be able to reach more people closer to where they live. And we'll be able to get closer to our target of immunizing all the persons 60 years and above.
Okay, based on the number, Minister, what has the response been like from the elderly population?
I think it has been good. Yesterday, for example, I visited one of our vaccination sites in Albion. And when I was there, we had a constant trickle of persons 60 years and above who were constantly coming in to get their vaccines, and that really is very good. We had also in that area community organizers who went out into the community, were able to identify those older persons. Some of them might not be able to walk long distances, so they help them by using some taxis, picking them up, bringing them to the site, getting them immunized. After they've been observed for the 15 minutes, then they take them back to their home. So I want to commend the persons who have been involved in that community effort, and I want to commend this method to other communities, because I think this is really helping. So whenever you know that there's a vaccination site that is operating, it would be good if the community leaders can assist us in mobilizing people 60 years and above, and to bring them to the vaccination site so that we can get more vaccines administered.
Okay. What about healthcare workers, Minister? Do you have a percentage as to how many healthcare workers have been immunized so far?
We have more healthcare workers who have taken the vaccines. I don't have the numbers offhand with me right now, but that has been improving constantly. And I think in some regions, we have been able to achieve almost 100% of the healthcare workers taking the vaccine, which is really good. In others, we are slowly getting up there. So people have been taking the vaccine. The demand for the vaccine has increased, and we are continuing to roll this out because we really want to get as much persons as possible immunized.
Okay, Minister. Now, I know Guyana is still awaiting the consignment of vaccines through COVAX. Can you say how soon this will happen?
We don't have a definite time when this is going to come in. COVAX, as I've said repeatedly, has promised us that they would be sending 100,800 doses of AstraZeneca vaccines to Guyana. We received a letter about a month and a half ago informing us of this. Unfortunately, they haven't confirmed the exact date when these vaccines are going to arrive. We're told that maybe we'll get a first tranche out of this 100,000, which probably would be about 33,000 doses, but we don't have any concrete information on the exact date when it's arriving and so forth. So while we welcome the vaccines from COVAX, we are also working actively to be able to source vaccines from other sources. And so we are, as of by the end of this week, hopefully, certainly by the next week, we are expecting to have at least 50,000 of the Sputnik V vaccine coming into Guyana. And thereafter, we'll be getting at least 50,000 doses every week until we get to about 200,000 doses. So over a period of a month, we'll be getting in these vaccines. And as we get them, we'll start administering. So when we get more vaccines, the idea would be that we'll be able to lower the age group. So as of now, we're still at 60 and above. When we get more vaccines, we'll be able to lower it to at least 50 and above. And then we'll also include some other frontline workers. So one of the groups that we're looking at would be teachers that we want to immunize in the next round. So we're trying to source more and more vaccines globally, but as you can imagine, we have a big challenge. All countries around the world now are trying to get vaccines. The source of vaccines are few. There are just a few global manufacturers, and everybody are going to these manufacturers to try to get vaccines. So there's a big competition for vaccines right now. Nevertheless, we are trying our best to make sure that we are able to get the vaccines that we need so that we can immunize our adult population in Guyana.
Okay, Minister, with regards to the Sputnik vaccine, is that a donation or has Guyana bought that?
We are paying for 200,000 doses of the Sputnik vaccine, and we'll see whether we'll need to buy some more.
Okay, Minister, thank you for that. Now, there are reports of a private hospital administering the COVID-19 vaccines to the general public. Can we have a comment from you on that?
Well, I don't think the private hospitals would be administering this dose to the public. We have started a collaboration with private hospitals, and we have given them vaccines for their staff. So all the healthcare workers that are working in each of these hospitals, they had sent us a list, and we have provided them with the doses to correspond to the list that they've sent us. So that was done. We hope that they're doing the vaccination as per our agreement. We have also enlisted them that at some point in the future, when we get more doses, that we'll be able to give them these doses, and they'll be able to open sites for us and administer these vaccines to the general public. That phase has not started as yet, and so the vaccines that they have is just for their staff. So I'm not sure whether any one of them would have violated that, but if that is so, well, then we'll have to check and make sure that that's corrected.
Okay, thank you for your comment on that, Minister. Now, internationally, a Florida woman who is a healthcare worker received her first dose of the Moderna COVID-19 vaccine at 36 weeks pregnant, and 3 weeks later she delivered a healthy newborn girl. Samples of the newborn's umbilical cord were taken, and there was traces of the COVID-19 antibodies. At this time, can you say if the vaccines available in Guyana are recommended for pregnant women as well as lactating women?
So first of all, we are not at that phase yet where we're administering to pregnant women or lactating women, because we are still at 60 and above. However, we have been following the guidelines, both of the WHO and the CDC, and we have started discussions with our local experts in obstetrics and the persons who are administering the vaccine here, and we'll put out specific guidelines when we get to the population that are lactating and are pregnant. The CDC in the US, they have very specific guidelines pertaining to pregnant women. None of the pregnant and lactating women, none of the vaccines that are currently in the US, that is the Pfizer, Moderna, and the Johnson & Johnson, when they did the clinical trials, they did not have a population of pregnant women that they administered this vaccine to. And therefore, there isn't any data that is available. Similarly, with the clinical trials with AstraZeneca and the Sinopharm and other vaccines, when they were doing these clinical trials, they did not go seeking out pregnant women or lactating women and administering these vaccines. So that data is missing. They don't have it. However, when you're doing trials, there are different stages of trials, and they have tested these vaccines on animals to make sure to see whether it's safe or not. And in those studies, they haven't found any adverse effect on the pregnant animal or its offspring. And so based on that, they're saying that these vaccines are safe. And the other thing is, because the vaccines are not live viruses, therefore it wouldn't cause an infection in the pregnant mother or in the baby. So these are considerations, and therefore the CDC in the United States have recommended that if a mother would like to have the vaccines, that in consultation with the healthcare team, that she can be given the vaccine. So in their context, their recommendations have been, if somebody requests it, then you can give it. And same goes for lactating women. So the case that you have cited, I guess, fall into that category whereby this person might have requested it and they have been able to administer it. And it proves the point that it's not harmful against the mother nor the baby. So as you get more and more of these cases, we'll be able to acquire the data, and hopefully when we are ready to administer to that grouping of persons, that there will be more data available internationally for the different vaccines that we're using. The other thing that you have to bear in mind is that the platforms that some of these vaccines are using, whether it's the Johnson & Johnson or Sputnik vaccines, these have been platforms that have been used for other types of vaccines, and they have been proven to be safe. So it's not like new technology. This technology of making vaccines have been around for a while, and they have use it on pregnant women and lactating women. And in those cases with other types of vaccines, it was safe. So, but when we get there, right now, as I said, our local experts are discussing it, and we'll follow the international guidance that is available, and hopefully we'll see more scientific studies pertaining to women who are lactating and who are pregnant. We'll see more studies pertaining to the safety and efficacy of these vaccines in this population.
Okay, thank you for that, Minister. Now, before we go, I have to ask, for clarity's sake, if a person tests positive for COVID-19 and has been cleared in their time of institutional quarantine, how soon after can he or she receive their vaccine?
So that's a very interesting question, because if somebody post-infection, that person would have in their system antibodies that are circulating. If you have antibodies that are circulating, it means that if your chances of getting reinfected would be quite low because of those antibodies that are circulating. So because there's a relative scarcity of vaccine globally, the WHO has been recommended for such persons who you know to have recovered, that they wait some period, a duration of time, and I think the WHO has recommended about 6 months, before you get your your first dose of the vaccine. However, that is really based on the scarcity of the vaccine, the doses not being available, right? Because that person would have antibodies that protects them against the infection. In other countries, in the US and so forth, where they don't necessarily have this scarcity problem, what they have been doing is if you, when you recover, if you want to have the vaccine, there's nothing stopping you from getting the vaccine. So the vaccine can be administered. So there are these two contending views. So in resource poor settings, where vaccines are not readily available, those who have been infected and recovered are asked to delay getting the vaccine. In other settings, where they have more resources that are available, the trend has been, okay, if you want a vaccine, there's nothing stopping you from getting the vaccine. So we would, again, we have been following the WHO guideline, and we are right now reviewing some of these guidelines where we can probably lower the amount of time taken after a person would have recovered to administer the vaccine. Those new guidelines, I would say, would come out over the course of this week, especially with the AstraZeneca vaccine. So that's something that we'll be working on and we'll be presenting shortly to the general public.
Thank you very much for that, Minister, and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.